Hello everyone, I am Dr Sandip Bipte, consultant breast surgeon working at Apollo Cancer Center in Navi Mumbai. So today we're going to discuss about the how to not get confused between the postmenopausal symptoms and a breast cancer symptom. So a lot of patients come to us with this similarity and facing the issue. So let's understand what's the similarity between the two things. So let's understand what is menopause. So basically, menopause is a natural decline in the reproductive hormone which happens at around the age of say 45 to 50 in every woman's life, which leads to the cessation of menses, right? And which leads to certain symptoms different symptoms. We'll discuss about that, and the certain things about breast cancer, which happen commonly at that age as well. So a lot of women get confused between the symptom. So why there is similarity between two things? So first of all, the menopause is a natural thing, but a breast cancer is not a natural thing. So two things are absolutely different. So let's understand what symptoms they'll create. So somebody who is going to menopause, so she's going to face a symptom like irregular periods, the vaginal dryness, the hot flushes, especially sometimes they feel chills, they feel sweating in the scalp at night time. And typically, the most common is a mood swing. That's a very, very common symptoms. And some of the women get the weight gains. And the metabolism goes slow down. So these are the symptoms which happens during the menopause symptoms. What says when you talk about a breast cancer? So the symptoms are completely different. So when you talk about breast cancer, the symptoms are like a lump in the breast, right? So most common the lump in the breast or in the armpit. The another symptoms the in breast cancer like the nipple discharge, but it's a bloods and nipple discharge. So if somebody is coming with the bloods and nipple discharge, it's highly suspicious of breast cancer. The third symptoms is a change in the shape of the breast. So a lot of women coming with the change in the shape of the breast, which can be a symptom of the breast cancer. Even in menopausal females, sometimes they feel the change in a shape of the breast, or that's because of sagging, they feel that. But in postmenopausal, there is just sagging, and here you can see a complete one-sided breast lump or one-sided chin shape. In menopausal, there will be a both sides. So this will clearly distinguish between the two symptoms. And the fourth is sometimes you get a whole breast get completely swollen. We call it as purity orange, right? It's an advanced stage of breast cancer. So these symptoms won't come in a menopausal symptom in a natural course, right? So easily can be distinguished between the two in menopause and the breast cancer. And lastly, in a breast cancer, a lot of patients come with a nipple retraction, and that is a classic one-sided we call it as unilateral nipple discharge, and this can happen to the breast cancer. Versus in a menopausal woman, it doesn't happen. If nipple retraction happen, it will happen on both sides, but generally it does not happen in a natural course. But abnormally in a breast cancer, it does happen. So there are different symptoms of breast cancer and menopause symptoms, which easily can be distinguished. But especially when there are hormone changes happen in the body, the end organ like breast are generally affected, and there is always there is a confusion between these symptoms to distinguish: am I suffering from breast cancer or this is a menopause symptom? So these are the two different categories of symptom. One should not get confused, and do a self breast examination. That is more important. So if you follow your self examination, say by from the age of 40, you will come to know, oh, these are my normal symptoms and what are my post symptoms, and the if something abnormal, we can easily detect any lump in the breast which could be suspicious. So by this, just doing a self examination and knowing the symptom, one can easily distinguish between the menopause symptom or versus the breast cancer. Thank you so much.